Good morning and thank you, Dr. Grover and other chairpersons for this wonderful opportunity. Medicine used to be simple, ineffective and relatively safe. Now it is complex, effective and potentially dangerous. And these are the reasons why accreditation is required. The changing public expectation of doctors, globalization of and international standards in medicine, and diversity in medical education. With the advent of private medical colleges and lowering standards in the government colleges, this is needed. And with the advent of medical tourism and the pressure of the insurance industry and regulatory bodies, accreditation is here to stay. This emerging healthcare scenario in India in 1980s, healthcare does not need it. It was more of an industrial requirement for the manufacturing industries. In the 90s, it was a fad of few corporates, led us to no harm, not relevant to Indian healthcare system. But in 2000, it was a useful tool, must for a well-run organization, but it's required urgently. These are the options for assuring quality in healthcare. Licensure, of course, is mandatory. And then the quality assurance and management systems like ISO. And to improve on that, total quality management and quality assessment accreditation, which NABH has proposed now. What does this mean? Accreditation implies official recognition, general acceptance and assurance of quality. This is based on written and published standards. So it's known to everybody and the review is conducted by your own professional peers and it is administered by an independent body. The aim is to encourage organizational development. So these are the benefits, maybe major benefits or minor benefits, primary or second, and multitude of tertiary benefits. So the basic aim is to promote the practice development program of the hospital so as to make it viable and sustainable. There are a lot of benefits in accreditation for all the stakeholders. It raises community confidence, the stamp of authority on community confidence. It increases customer satisfaction. And it benchmarks your hospital with other group of hospitals. And there's good return of investment. What the previous speaker was talking about, accreditation gives a good return on investment and it improves financial performance. It also improves care and enhances public confidence, stimulates continuous improvement and good governance of the hospital. For the medical and paramedical staff in an accredited institution, it improves professional development and it provides education and training on consensus standards, increases job satisfaction with good HR practices and accountability. For the employees, the Accreditation Institute values employees' opinion, it measures their satisfaction, it improves safety and security, and there are clearer lines of authority with good job description and accountability. For the patient, it ensures access to a quality-focused hospital, their rights are respected and protected, and there is understandable education and good counseling and communication process. Their satisfaction is evaluated on a day-to-day basis and the focus is on their safety and care. So it's a win-win situation for all the stakeholders, patients, staff, management, and in the end, government has really entrusted this activity to the accredited agencies because it is not their outdated bureaucratic mechanism is not able to ensure compliance to regulatory and legal acts. But there are multiple challenges and these challenges start at the government level. The common problem is because of the lack of commitment, cooperation, collaboration between the various stakeholders and last and more importantly, the attitude of the hospital. As I said earlier, the accreditation challenges starts at the governmental level. The statutory and legal requirements which are outdated and very difficult to comply with because most of the legal requirement has not kept pace with the scientific advances in our field and the technological innovations. And you all agree with me that red tapeism and corruption exists in each and every part of our country and this makes getting a single certificate very difficult. The weakness in leadership, management, planning, implementation and evaluation. Most of the doctors are good clinicians but they are poor managers. So accreditation is a good marriage of management and good medicine. Most of you, when we go to the hospitals, they ask how much it costs to get a NABH certification or ISO certification. On the contrary, what is needed is regular opportunity for systematic review of hospital. We spend at least 8 to 10 hours seeing patients, but hardly spend half an hour to see the management aspects of our practice. So what is more important is the time for systematic review of hospital functioning. What we need is relevant, accurate, and complete timely data as administrators for the hospital and information on the academic and practical guidance on standards and measurement. The other resources for accreditation are skills, quality coordination, the technical skills and training manpower, and of course money is needed for the basic tools, information and training of manpower. The other challenge is shortage of skilled health professionals, and this is evident all over India, particularly in ophthalmology, shortage of skilled manpower with respect to optometrists, doctors and nurses. And the other difficulty is integration of standards in all the units. So poor documentation, this is one major issue with doctors. We are not tuned or taught for documentation in our medical curriculum and accreditation dealing syllabus in our education. This aspect needs to be addressed in the academic forums. The delivery system is fragmented, payment is quality neutral, there is no pay value for quality. If you do more things, you get more money. So there is no for quality work. This is one more challenge. Basically, accreditation program puts the patient first, it improves the clinical performance, creates a well-functioning and well-knit hospital, and links the hospital to the general healthcare system of country. To conclude, perception of the present managers and doctors is that I already have a good practice. What value does accreditation adds? And it acts actually only for corporates and medical tourism providers. As of now, it's very difficult, not practicable, and it's costly. Why do it now? But in reality, it's a very good branding and marketing tool and management tool. Cost effective, it improves all your business aspects and image of the hospital, enhances quality and reduces risk. So that's the conclusion. Thank you so much for your attention.